So, doctor, just how bad is the emergency care system in our country? We hear that it's in a crisis. Is that an overstatement?
I think it's a crisis that the American public is largely unaware of. I'm glad you're asking that question, because people watch television and they see programs on emergency and trauma, and they see people picked up by a helicopter and taken to an emergency department or taken to a trauma center and life being saved. And that happens. But that happens sporadically and in isolated areas throughout this country. I'm now going to talk about the nation, because the Institute of Medicine Committee, of which I was one of the members, addressed the national crisis. And what we rapidly concluded was that our emergency systems in this country are overwhelmed, understaffed, underfunded, and in many cases, simply there is no system at all. It's non-existent. Wait times in emergency departments, which people sort of aren't aware of until you happen to be the person who goes and has to wait for 6 or 8 hours in an emergency department. There are some places in this country where it's not 6 or 8 hours, it may be a day or two, Las Vegas being one of those. We have communities, not San Diego fortunately, where ambulances will circle for hours and hours to find an emergency department that is open and can take a critically ill, and now I'm not talking just about trauma, but heart attack, stroke, critically ill patients, who's open and can take them. So it is a huge crisis, and unfortunately largely unrecognized. And this was the impetus for the Institute of Medicine, which is a governmental agency. The Institute of Medicine is part of the National Academy of Sciences and is meant to take an objective, critical look at healthcare problems in this country and then make recommendations to Congress. And we made some pretty strong recommendations about what to do to try to correct this. I think the American public has to realize that they may be increasingly in a position where there's nobody there. They may go to an emergency department, but there may be nobody there to take care of them. And that is happening, and it's going to happen in this country unless we wake up and say we have to put the same resources into emergency and trauma care that we have appropriately put into heart disease and into cancer, because it is the #1 killer of our children and people under 40 years of age.